SQUIRE trial has been the largest trial performed in patients with advanced squamous cell carcinoma, and the therapeutic options that we do have are very limited. So we investigated the addition of an EGF receptor antibody, necitumumab, to the standard, which is chemotherapy with cisplatin and gemcitabine, and what we did observe indeed has been a significant improvement in overall survival and progression-free survival in favor of the combination with necitumumab. Now we do know that squamous cell patients are different from normal lung cancer patients. They do have more comorbidities, they do have more symptoms. Treatment is a little bit more difficult in this group of patients. And therefore we were curious to see whether we also are impacting the quality of life, the symptoms of the patient. And on the other hand, we also were curious to investigate whether the symptomatic situation would impact the efficacy of our treatment. So what we did, we looked on the severity score of the patient, the symptom score of the patients. We do have a general score, the LCSS, which is summarizing a couple of very important symptomatic issues characteristic for patients with lung cancer. And what we did see, and this was quite expected, was a very good correlation with the prognosis of the patients, which means symptomatic patients do have a poor prognosis with squamous cell lung cancer. This was something that we also expected. In a second step, we looked on the predictive impact on the symptoms of the patient. And we looked on the maximum severity score, which means we looked on the worst part of the symptoms which was present at the patients at baseline, and we correlated it to the impact of any treatment. And what was quite interesting, that in the group with the worst symptomatic presentation, in the group with the highest severity score at baseline, we did see the best therapeutic impact. And this was true for overall survival, and this also was true for progression-free survival. And with other words, you may say that the symptomatic patients did benefit most from this treatment with cisplatin, gemcitabine, and necitumumab. And we also did observe the major impact on the symptoms of the patient in this group of patients, which has been induced by the combination with necitumumab. So this was quite an interesting finding, and this hasn't been investigated before in any other lung cancer trial.